right, everybody, a warm welcome. Good afternoon. Welcome to the McCain Health and Wellness Talks. It's in association with ProVeg International. We just had a fascinating discussion around natural hormonal health with Marianne Shearer, and there's loads more coming today. The next one, in fact, will be at 1:15. If you're into bodybuilding and wanting to build some muscle, but you also want to be healthy and eat plant-based, then that one is for you. It's with Daniel Lawrence, building muscle on a plant-based diet. That's at 1:15 this afternoon. Let your weightlifting and bodybuilding friends and family know about that. Right now, we want to get down to brass tacks when it comes to plant-based pregnancy and infancy. This Plant-based Pregnancy and Infancy is going to be moderated by Arlene Nell. She's the communications manager for ProVeg International. To introduce your panelists for you, Arlene.
So much. All righty. Am I on? There we go. Hi, everyone. Thank you so much for attending our talk today on the McCain Health and Wellness talk stage in association with ProVeg. As Bobby mentioned, my name is Arlene. I'm the communications manager for ProVeg South Africa. I've had the pleasure of moderating a similar panel last year at the Plant Powered Show, and today it's my pleasure again to have these amazing experts here, and really do take note and take all that advice home that you can get. So we'll kick it off by just introducing our panelists. To my left, I just can't look at you apparently. We have Jessica Kotlowitz, who is a registered clinical dietitian with her own practice in Cape Town called The Green Dietitian. Do go look her up. So she's experienced a very healthy lifestyle as a vegan, has had one very healthy vegan pregnancy, and her little toddler is here with us in the audience. And she's currently in her second vegan pregnancy. Then again to my left, we have Dr. Anastacia Tomson, who's a medical doctor, author, and an activist. And she's expanding access to competent and sensitive healthcare to minority groups, especially in the Sea Point area. She offers primary care services in Cape Town, and vegan nutrition is one of her focus points, so she will be helping us today with that. And then finally, we have Carla Gontier, who is the co-founder and co-owner of Grumpy and Runt, a little donut shop there in Cape Town. I've sampled many of them. Thank you. You've changed my life. So along with her is her wife and business partner here today with their 8-month-old little baby who's born from a vegan pregnancy. Have a little Lion King moment lifting her up. She was born from a vegan pregnancy and is now a healthy 8-month-old little vegan. So let's kick it off. Dr. Anastacia, I want to ask you, as a primary care GP with your practice in Sea Point, have you experienced an increase in patients considering pregnancy and parenthood that want to take on a vegan or even a vegetarian lifestyle?
Yeah, I think there's definitely a growing number. I thought you were going to ask me for a moment, am I seeing more pregnant vegan patients? But I'm not, because they don't need a doctor. But there's certainly a lot of interest growing, and I think people have a lot of questions. There's so much in healthcare and in medicine that we're starting to interrogate and question instead of just going along with how we've done it for generations. And I think that's one of the misconceptions, especially amongst healthcare providers, is that you would need to consume animal products. And it was almost taken for granted that, particularly during pregnancy and child rearing, that's kind of a non-negotiable. And people are certainly starting to interrogate that. And as we move towards more sustainable choices in the way that we live, asking ourselves the question, can I proceed to raise a family without changing my vegan diet? So I think the tide is starting to turn.
And then, Dr. Anastacia and Jessica, as a medical doctor and a registered clinical dietitian, what would your recommendation be, the first steps that someone should take if they're considering a vegan pregnancy or raising their infant with a vegan lifestyle?
Should I? Okay. I mean, I think for me as a dietitian, the first step I would want anyone to take is just to be educated about how to meet their nutrient needs as a vegan. And if you're bringing up kids vegan, how to meet a baby's nutrient needs and a toddler's nutrient needs. And obviously, we don't have extra concerns because people are having a vegan pregnancy or a vegan baby, but I guess the nutrition science out there is specifically aimed at like meat eaters. So what we generally know about nutrition is, you know, you get your iron from meat and you get your omega-3s from fish. And we kind of, when we go vegan, we need to learn like where do we get our omega-3s from? Where do we get our iron from? And it's just important to know how to meet your nutrient needs.
Yeah, I defer to you on that question because my answer is I really think that your first point of call should be a dietitian, and I think that you should be adopting an informed and an evidence-based approach to what you're doing. And one of the things I encounter with a lot of my patients when I do make the suggestion of, well, have you considered seeing a dietitian, is, well, you know, I eat pretty well already. And, you know, I think it leads into this kind of misconception around the role that different members of your health team play in guiding your navigation through that process. So I really think it is valuable to sit down with someone who's got the expertise, the knowledge, the training, and certainly the lived experience helps, to really empower you with the kind of information that you will be able to rely on instead of deferring to sources that are not necessarily accurate, not necessarily reliable, and certainly in the best case scenario, even if the article that you find on Wikipedia does have good sources, it's written for a very general audience and not for you. So I think it's really important to get that kind of baseline and understanding of what you need and how to meet those needs, because again, it's different for everyone. Yes, we know everyone needs B12 and everyone needs iron, but we need to tailor that to your particular circumstance. And I think leaning on professionals for that and engaging their services is really, really vital.
Fantastic. I think, Carla, over to you. From a lived experience, so you and your wife are both vegan, and you decided you wanted to add a third little adorable blonde-haired vegan there to the family. When you decided you wanted to start your family, did you know you wanted to approach it from a vegan lifestyle perspective?
Yeah, absolutely. I don't know if anyone's ever met my partner, Yoka, who's hiding somewhere. But she's incredibly incredible activist in terms of, you know, wanting to be vegan and educate people on veganism. You know, we started our whole business with the aim of subtly injecting veganism into people's lives by feeding them delicious donuts. So yeah, it wasn't even a question for us. We were always going to raise River as a vegan little baby.
Fantastic. And Carla and Jessica, you've both had, or in your experience, been through vegan pregnancies like we just mentioned. And I'm sure you know people who've been through non-vegan pregnancies. How would you, accept the diet being different, how would you compare the pregnancies to those? I know comparison is the thief of joy and we shouldn't, but just in your experience, because that's that knowledge that you can share with someone here who might not have gone through a vegan pregnancy, how would you
first
compare?
I mean, it's so hard for me to give like an unbiased take on this because I have a nutrition practice where I see mostly vegans and vegetarians. I've never seen many meat eaters that are pregnant in my practice, but something that I've noticed, just observed, and I don't know if it's proven or not, is definitely that vegans and vegetarians tend to have less nausea during pregnancy. That's just something that I have noticed. I mean, obviously people get nausea during pregnancy, but it doesn't seem to be as severe. But other than that, I've always observed that vegans and vegetarians have pretty healthy pregnancies, no major complications. Most of them go till full term. So I think if you're meeting your nutrient needs, there's nothing to be concerned about.
Yeah, I mean, I think the biggest thing for me was that there is actually no difference. You know, my wife had an incredibly healthy pregnancy. You know, didn't have to go for any additional checks, or our OBGYN thankfully was very. He actually praised us when we said, "Oh, we're vegan." He was like, "Oh, great! Then you're not going to have any like major health issues." So yeah, I think the biggest thing for me was that I thought that we might have to have like additional iron or B12 needs, but he said, yeah, everything was fine.
Jessica, I want to ask you, and Dr. Anastacia, if you want to weigh in, please do. When it comes to either breastfeeding or bottle feeding, how do you ensure that your infant is getting the right nutrients when you have a vegan lifestyle?
So between 0 and 6 months of age, infants get all their nutrient needs met by milk, either breast milk or formula milk. Formula milk is, made to have all the nutrients that an infant needs until 6 months of age. So if you go for a commercial formula, you don't have to think about anything, whether your baby's vegan or not, they're on formula milk, For breastfeeding, what we eat as breastfeeding parents does affect the nutrition of our breast milk. So if we have certain deficiencies or we're not getting enough of certain nutrients, then those nutrients could be low in breast milk. So I always like to counsel breastfeeding parents on, which nutrients they need to focus on, what they need to supplement, especially if they are vegan or vegetarian. Just, how to get enough omega-3s in, how to get enough choline in, those sorts of things.
Yeah, not very much to add, just that, one does have to understand the evolutionary pathway is for the mother to provide everything that child needs. I think people have a lot of uncertainty and misgivings around this. And really the most important thing is just to reassure them and ensure adequate nutritional support for whoever is producing the milk, because it does place a burden on someone's body. So recognizing that while you're breastfeeding, your needs might be different for that period of time. But certainly no specific needs that would have to be met in someone who's vegan, who's breastfeeding, as opposed to someone who isn't.
And then, Jessica, I want to ask you, so you have had one vegan pregnancy already. We've seen the curly head, beautiful, I didn't get his name again.
Gabriel,
the beautiful curly head Gabriel walking around here. And you are currently pregnant again with your second child. So how do you ensure that Gabriel gets all the nutrients that he needs in his diet? What is it, maybe you can take us through, what is a typical breakfast, lunch, and dinner look like for him at this stage?
Sure.
And for a toddler up until the end of toddlerhood?
I mean, if you've ever had a toddler, you'll know that their eating is very unpredictable. So we kind of go with the flow. But I always say to parents that it's not your job to get your child or your toddler to eat certain things or to eat certain amounts of things. It's your job to provide balanced meals for them. So we always aim to provide, 3 balanced meals a day, 2 snacks. He also does still breastfeed a bit. He gets fortified soy milk to help meet his calcium needs. And he does take a few supplements like vitamin B12, which is essential for anyone who's vegan. But basically, a day in the life would be like some sort of oats for breakfast with, coconut oil, flax seeds, that kind of thing. We try pump up the oats to make them more nutritious. We put some fruits with it. He loves fruit. Or we give him avo toast, which he loves. And then he gets a school snack every day because he goes to preschool. So I try to make sure that's a balanced snack with a little bit of starch, a little bit of protein, some fruit, some veg. It varies. It's usually little finger food type of things. And then lunch and supper for him are the same because we always do we cook once a day, so we do leftovers for lunch. And that's just normal plant-based meals dal and rice with vegetables in it, or we'll do a lentil bolognese, we'll do different types of pastas. So his diet's pretty similar to our diet.
And how have you experienced his taking to the diet? Just is he curious, do you think, to try more flavors than a non-vegan child?
I'm not sure if it's like vegan versus non-vegan, but I think we brought him up, exposing him from a young age to all foods. We did like baby-led weaning kind of style. We didn't do purees. We exposed him to like all the herbs, all the spices, sour foods, salty foods, sweet foods, everything. So he's definitely more of an adventurous eater than a lot of toddlers. We also don't put pressure on him to taste things or to eat things or label certain foods as healthy or unhealthy. So I think he's really like neutral towards foods, and without that pressure, he has a more positive attitude to eating. So yeah, in general, I mean, there's obviously the picky eating that comes with toddlerhood, but in general, he's pretty open to things, and yeah, he loves most plant foods.
And then I think just to end off, and then I want to open it up to the audience because I'm sure there's quite a few questions here. Again, just Jessica and Carla, obviously when a person decides to go on a plant-based diet, whether very strict or a bit more loose, there is some social reaction to it in your immediate community. And I can imagine that when you choose to raise your child as vegan, there's also some social friction happening. Can I ask what your experience has been?
Yeah, I mean, thankfully, I'm quite antisocial. We don't see a lot of people in our lives, so we don't come up against that. But when we do, we were recently at a wedding, for example, and we had an aunt, but very gently and very kindly say, "Oh, but where are you getting her protein from?" And so, yeah, it was just met with, obviously kindness back to just say, well, this, you can actually get protein and iron from, a range of different places, not just a bit of meat. So yeah, on the whole, I think, my friends as well, they have questions, but it's been, I think, more curiosity than anything. There's I think, very, very rarely have we met any kind of stern sort of, you need to be feeding her more, protein. So, and if we do, I think, again, just meet it back with kindness and education. Just say, well, actually, there are a number of places you can get all of your sources from, and anything that is lacking, meat eaters are also lacking in quite a lot of vitamins as well. But yeah, there are things like vitamin B12, either injections or the supplement tablet to take. So yeah, I think that's how we've kind of approached it.
Jessica, with you, obviously, this is the space you work in, so you are ready with the facts.
Yeah, I think, no one openly criticizes my choice to bring my child up vegan to my face. So if they do have questions or criticisms, they maybe keep it to themselves. But I also think because I'm a dietitian, people sort of do trust that I know what I'm doing. So even when we, take him to doctors and they find out that he's being brought up vegan, they're like, oh, but you're a dietitian, so it's okay. You must know what you're doing. And they don't really challenge me much on it. But one challenge I do get a lot is people asking me, like, what are you going to do when he's older and he maybe wants to try non-vegan foods? And my answer is always just like, he is his own person and he does have to make his own decisions in life, but we'll always have a vegan home and there'll always be vegan food served to him at home. So yeah, that's our decision of, like, we want to allow him to obviously make his own choices, but we do trust that if he gets brought up in a vegan home, he'll most likely decide to be vegan.
That is a big part of the psychology with a lot of people, even myself as a flexitarian. You're raised in a omnivorous home, so that's what that's your reality. But if your reality is you grew up in a vegan home, then it's not that strange to you, right?
Yeah.
Exactly. I think we can open the floor up if there is some questions in the audience. Do we have any questions here? Just a few shy folks. Okay, I'll kick us off. I have not been pregnant and I'm not currently pregnant, hopefully in the future, but I do already struggle with a lot of hair loss, and I know postpartum hair loss is a big thing for a lot of women. Is there something Dr. Anastacia and Jessica, maybe from a diet perspective, that you could recommend that would assist or help in any way?
Yeah,
Asking for a friend?
you know, again, I think that there are so many factors that you have to understand. When you notice a change in your body, a hair is thinning or falling out, or nails are becoming brittle, or skin is getting flaky, or energy levels are low, it is your physiology trying to communicate with you in a way that you'll understand. And unfortunately, or what makes it difficult, is that all of these mechanisms tend to be fairly non-specific. And I'm not going to go into the detail behind the metabolic pathways that underlie it, because we just don't have the time for it. But it's telling you that something is up. And it's very difficult to give you a blanket recommendation that would be both safe and effective to treat that. So again, what I would say to you is consider that as communication from your body. Something is going on, and try and get access to supportive medical attention that will help you to unpack that. So in my practice, I see a lot of complaints of fatigue or thinning hair or whatever it is. And a lot of times people will come in with their Google diagnosis or their Dr. ChatGPT diagnosis and say, this is my thyroid. And, you know, I will never invalidate that, and I'll say, sure, I understand why you would think that that fits. There are certainly other possibilities, and this is how we'll collaborate to make a plan to figure out what it is. So, you know, I'll do a comprehensive clinical examination. I'll do a panel of blood tests that are appropriate to this. And I had a patient just this week who came in with an internet-diagnosed hypothyroidism that turned out to be a very low iron and vitamin B12, which we're now treating. And I'm beyond 100% certain that her hair is going to grow back once we've addressed that. So seek out the care and support of people who work in those spaces, and we'll be able to guide you with that.
I think it's a general good rule: stay away from Dr. Google. Because that's a rabbit hole you don't want to go down. Jessica, is there anything you wanted to add to that?
I just wanted to add that obviously postpartum hair loss is normal and to an extent unavoidable because it's caused by hormonal shifts that happen postpartum. So I don't want to pathologize that for anyone and be like, oh, if you're having postpartum hair loss, go and do 100 blood tests. But obviously if there are underlying things, it can exacerbate that hair loss. So if you already had hair loss before pregnancy or during pregnancy, or there is an underlying deficiency or thyroid condition, then your postpartum hair loss will be worse. So unfortunately, to an extent it's unavoidable, but there are things that you can do to make it less severe, I think.
Are there any other questions in the audience? They're so good at their job, they answered all your questions, eh? Oh, we have one.
That's a very good question.
Okay. Maybe just repeat it for
Okay,
for
so
the audience.
he asked if there's a difference between a dietitian and nutritionist. And basically, in South Africa, at least at the moment, dietitian is a protected title, so you have to have a certain qualification to call yourself a dietitian, which is usually like an honors equivalent Bachelor of Science degree, and you have to be registered with the Health Professions Council of South Africa, and you have to practice under certain like ethical obligations, right? So you can't just go around telling people to pop certain supplements or buy certain things. You have to really be ethical and evidence-based in what you say. And in South Africa right now, it is changing, but nutritionist is not a protected title. So basically anyone on the street can call themselves a nutritionist. So what we always say is dietitians are nutritionists, but nutritionists are not dietitians. And if you are looking at information where someone is calling themselves a nutritionist, do some research on what their qualification is, where did they study, are they registered with any professional bodies, because 99% of the time they're not, and they've just done like an online course, or they're like a personal trainer who did some nutrition in their personal training course, that kind of thing.
Maybe a last question I think maybe a short fire round line of advice for someone who is considering a vegan pregnancy. Carla, you look terrified. But can I start with you?
Oh, good. No, my only advice, I think, is to take the supplements. I think the prenatal vitamins are critical. I think that they are for everyone who's on a plant-based or non-plant-based diet. It's, that's
Perfect.
my hot tip.
Great.
Pregnancy.
Dr. Anastacia?
Yeah, I think I'll just echo that and say get the support you need, but also stick to your guns. I think one of the greatest tragedies is when health professionals who themselves don't actually have all of the training. Here's a secret for you, is that the majority of doctors know that much about nutrition because it's not taught to us, you know, and I think it's really a shame when people are bullied into making choices that they don't agree with, especially when there are people out there who will support and affirm and empower you with science and evidence that can allow you to do this safely and ethically.
I mean, they kind of covered everything I wanted to say, but
Maybe from a personal side.
I would say, again, like, yeah, seek the support you need and be educated going into it, because you probably will receive some criticism or some pushback, even from some of your health professionals. And if you have the right support and the right education and you can kind of educate them, then that will be really useful.
I think we can give a massive round of applause to our panelists. Thank you so much for joining us today. And please do, you know now where to find them. Jess, the Green Dietitian, and Dr. Anastacia has a practice in Sea Point. So please do search them out if you or anyone you know is thinking about parenthood or is already in that stage and needs evidence-based, safe advice.
Or
Thank
donuts.
you so much. Exactly.
I'll do the donuts. You guys can do the dietitian.
Get the donut first and then meet them at their practices. Okay, thanks everyone. Have a lovely day.